Now I'm going to show you how to set up a ClearSight. ClearSights are used for non-invasive blood pressure monitoring and for cardiac output. So when you first plug in your ClearSight, turn it on, you're going to see this screen pop up, all the patient information. So whenever you plug it in, you want to connect our arterial line to our monitor so we can see the waveform pop up whenever we get a patient connected. So just make sure that's connected into the brick. And then for here, we're going to just type in patient information. So these are three options. So we're going to do a ClearSight, which is non-invasive, so to the right. Then we're going to do proceed to setup. Okay, so it's going to give you this zeroing option right off the bat. So what we can do is go ahead and zero it. So you're going to take this cord, Edwards cord, this heart monitor, and you're going to line the two lines right here together. Press 0. And you'll place this at the patient's heart whenever you're monitoring the blood pressure. All right, so now we're going to show you how to put on the finger cuff itself on the patient. So sizing is very important. That's why we have to measure the patient's finger before we decide what cuff to use. So it comes with this cool measuring stick we can use. So we're going to put that on the patient's kind of middle phalange right there in between the knuckle and this area. This is where the artery is going to be placed, or this is where they're going to be measuring the blood pressure. So I'm going to place it around there. Kind of like that, and you can see it. It shows large. So we're going to use a large cuff for this patient. You can get our finger cuff. We're going to put it under the patient's finger. Kind of open this up. We're going to have the patient's finger go in between the green lines between these two sensors, like that. Like so. Again, align it in that little middle section right there. Comes with these tabs we can peel off, and this will stick to the patient like that. This overhead tabs and go over like that. So we're going to take this off, and it'll stick like so. All right, so after we place the cuff on there, we're going to grab our cord. After it has been zeroed, we're going to place it on this little slot right here. Goes like so. And then this cord that's coming out from the finger cuff is going to go into this port right here. It'll light up good. This is going to be placed near the patient's heart. Okay, once it's connected to the patient, we can start the monitoring. So you're going to see this start button on the upper left-hand side. You can go ahead and click that, and it'll be inflating the cuff. And we should get a waveform here in a second. And it should give you an arterial reading. You get a good waveform there, and it gives you a blood pressure. Now it's showing you the arterial blood pressure waveform numbers, and it also gives you all this cardiac output as well. Okay, so once we have a waveform and the numbers we want, cardiac output, everything, we want to get it over to our monitor here. So to do that, we're going to go to patient monitor, and it says to zero the patient monitor. So we're going to come here, arterial, we're going to go ahead and zero that. You'll see it says 0. We'll come back over here, we'll go to confirm, and then transmit waveform. And that should get you a waveform there.